Do you want to make your penis longer? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about an option that helps you increase penile length. It's called traction devices. Now, these are devices that are designed to not only increase penile length, but they can also help with a condition called Peyronie's disease, where you develop a curvature due to penile plaques. Now, these devices work on the principle of what's called mechanotransduction. And this is the process by which cells convert mechanical stimuli into biochemical signals. So in simpler terms, when we apply controlled prolonged stretching to tissues, it can stimulate cell growth and remodeling. And so in Peyronie's disease, which is due to plaque and scar formation in what's called the tunica albuginea, or the covering of the erectile tissues, this is actually meant to work by consistent, gentle tension that's meant to break down the tough scar tissue and promote the growth of healthier, more flexible tissue. Now, the good news is that these are typically cost effective. They have minimal, pretty well tolerated side effects, things like numbness, potentially pain, and bruising. And if you're using it correctly, those side effects go down quite a bit. Now, in this video, we're going to review 3 different traction devices that have all been studied scientifically in the literature. But in general, traction devices work by grasping the head of the penis and using a stabilizing ring at the base of the penis with rods in between. And the penis is then stretched, and the penis is stretched for periods of time. And the length at which you're stretching essentially creates the force, and that's gradually increased over time. Now, traction protocols are really variable, but typically they require several hours of wear over weeks and months. However, one of the devices we're going to talk about has been studied to work in as little as 2 sessions of 30 minutes a day. Do these actually work? Well, when looking at studies done on Peyronie's disease, there have been about 10 studies, and they've evaluated a variety of different traction devices on anywhere from 10 to 82 men for sometime between 1.5 hours to 5 hours per day. And they saw an improvement in these groups of a stretched penile length from anywhere from 0.3 centimeters to 1.5 centimeters, an improvement in the curvature from 4 degrees to as high as 31 degrees. And 2 of the devices we're going to review here, the Penimaster Pro and the Restorex, showed the best outcomes in terms of treating Peyronie's disease. Now, in terms of looking at penile length, so guys who have normal penises, no scar tissue, there have been 3 major studies. And they use one of the devices we're going to look at today called the Andropenis, and one called the Golden XL. Now, they studied a total of 88 patients over these 3 studies and saw an increase in stretched penile length, which is essentially a surrogate of erect length, of 1.3 to 1.7 centimeters. And they used the device in these studies for up to 6 hours a day for 6 months. And one of the studies even followed patients up to 1 year, meaning they used the device for 6 months and then they stopped. And so they measured them after 6 months of not using the device, and they saw that they maintained the change in length. Now, again, this is only after a year. We don't know if 2 or 3 years down the road it would still be maintained. And it's crucial to realize that these studies do show promise, but we probably need more extensive research to understand the long-term effects and what is the optimal usage of these devices. Now, many studies reported issues with patient compliance. Obviously, it takes a long amount of time and commitment to use these devices. There's also an issue with cost and availability. Now, with the advent of the internet, you can usually get them online, but they are not covered by insurance, and for some people, they may be too costly. And again, as I mentioned, the quality of evidence is not really high quality, but certainly there is evidence to support their role. And as I mentioned, the side effects are generally low, particularly if you're using them as suggested. All right, let's start off with the Andropenis Gold. Now, this is marketed as a medical penis enlarger, and it claims to increase length by up to 4 centimeters or 1.6 inches and girth by 1.5 centimeters or 0.6 inches. And the recommended usage is anywhere between 4 to 9 hours daily over 6 to 9 months. So there was a study using this device that recruited 96 men with Peyronie's disease, and half used the traction device and half didn't. And these were not randomized. They essentially chose to use it or didn't. And they used it for an average of of 4.6 hours per day. And they saw an average gain of 1.5 centimeters in stretched penile length. And the placebo group actually had a loss, which is not uncommon in Peyronie's disease. They also saw their curvature improve by 20 degrees, while the control group had an increase in 23 degrees in their curvature. Here is the Andropenis Gold penis enlargement device. It comes in this little box, and it has a little handy ruler on the end of the box. So it comes with a little bag there to carry things, obviously an instruction manual, the device itself, and some accessories, extension rods, as well as protective cushions, as well as 2 different types of silicone bands. So here are the main pieces. This is the plastic base as well as the plastic support. The plastic base is going to face your body and go around the penis. You want to essentially measure your penis at its fully stretched or erect length. Then you have these extension pieces that you can use based on your size. So once you measure your penis, you want to essentially pick the length that is about 4 centimeters shorter than your total length. These are the silicone bands that are protective. You want to place the cushion on top of the silicone piece there in the center so it provides cushioning to your penis. With the ends of the silicone band, you want to put them through the holes of that plastic piece because this is what's going to secure your penis in place when you have the traction device set up. And then you connect your extension rods into that upper piece. Remember, the thin plastic part of the ring is going to go towards your face or towards the top of your body when you put your penis inside. So here we have our sample penis. You put your penis in through the device, you find out where it's going to stretch, and then you essentially insert the head just so that this cushion is going to be right around where the ridge of the glans is. And then you'll tighten those silicone bands. There is this little place to secure the band so they stay in place. And then in their instruction manual, they actually have a duration that you should be doing it, starting at 3 hours for the first 5 days, 6 hours for days 6 to 10, and you can sort of bend it down or bend it up towards your body and wear it underneath your clothes. Now, the value of this, it comes with a bunch of comfort accessories. It's about $179 right now as of the making of this video. But the cons is, again, this is a really significant time commitment. And some users did report difficulty wearing the device for really extended periods of time. And so then they're seeing inconsistent results. So for example, one user reported that they increased their penile length by 1.9 inches. And they said, my girlfriend is amazed to see how much longer my penis has grown. However, other users have seen some side effects or no change at all after using the device. The Penimaster Pro. So the Penimaster Pro has 2 options. It has the rod expander as well as a belt system. And it differs because it uses suction to keep the head of the penis in place rather than grasping it with some sort of clasp. And this allows for a little bit more comfort compared to the other options. In terms of studies, there was a randomized multi-center study of 93 patients who had stable Peyronie's disease, meaning they were not changing in terms of curvature. And they saw an overall increase in length by 1.8 centimeters and a change in curvature by 31.2 degrees less curvature. They used it on average for 5.2 hours, but they did notice that when they used the device for less, say less than 4 hours a day, they still saw an improvement, but it was only 19 degrees compared to when you used it for more than 6 hours, you had a curvature reduction of 38 degrees. So again, the more you use it, the more benefit you're going to see, but you will still see a benefit if you use it for less time. This is the Penimaster Pro. Comes with a ton of accessories, but don't get overwhelmed because you don't need to do anything with these right this second. Comes with the storage bag, which again, I always appreciate. So it comes in several different boxes. The first box has instruction manuals and videos. This is a strap which you can use to use the traction device as a wearable option. That's a little bit a different variation. Here we have our main piece as well as the extenders. And here's some extra accessories as well as the lubricating gel, the ball pump valve, and the piece that goes over the glands. And these all have fancy names, but ultimately you just know it goes on your glands. Okay, so here's the main piece, very similar to the andropenis, and this is the piece that goes over the glands. Sorry, it's a little bit blurry. So first you want to place some gel on the head of the penis as well as on the inside of your piece that's going to go on the glands. So now here's the important part. It comes with this ball, and they have grooves that you can squeeze down the ball, you attach the device, and you twist after you've attached it. Keep holding that ball down, put the head of the penis right at the opening, and then let go of the air. And it should pull the penis and head of the penis into the device without you having to push or anything. It should just sort of pull it in. And then you just pull off the bulb here by a twist, and you see it's still very snug and in place. Now, similar to the other device, you're going to put your penis through the device, and that little piece on the top, the glans holder, is going to fit right into that groove. You hear that snap? And then again, you would base this on your size, so it would keep traction on the penis. You can again put this up towards your belly, down, and again underneath your clothes. So this glans piece comes all assembled. So when you go into the instruction manual, they'll say, oh, add all these things. It's already assembled when you get it. So there's really not much you need to do unless you need to change the size of the inner workings. So this is a strap that you can use in addition to it. Instead of using the device, you can use the strap, which allows you to clip it in place. And then it has a whole bunch of securement locations. So you can wear it around your shoulder or strap it around your leg and have tension based on how much you're pulling the actual strap. And then once you're done with the device, you just reattach the bulb and twist, and that will let go of the suction, and your penis will come out without any issues. Now, the pros of this is it can be used in various different ways. Sometimes you can wear it during physical activities or even at bedtime. It can be worn under the clothing or even during sleep. Now, the cons are some people do find it to be complex to use, and some people struggle with the vacuum seal and suction problems with that glans device. Now, it does, if you're using the weights, max out at 1.2 kilograms, which might not be sufficient for all users. It costs about $260 to $468 depending on which one you use at the time of recording this video. When you look at user reviews, some people say it's really comfortable, but other people feel like it's pretty cumbersome to use. And when it works, it's great. And when it doesn't, it's a little bit of a struggle. Another person reported that they got 0.5 inches after about 4 months of use, which sort of makes sense based on the findings in the studies with this device. All right, next up is Restorex. So Restorex is a traction device that was developed at the Mayo Clinic, and it's specifically designed for Peyronie's disease and penile lengthening. Now, this one works a little bit differently in that it's meant to angle the penis opposite wherever the curvature is to create a counter traction and allow you to sort of break up that plaque. Now, the recommended usage for this is only 2 30-minute sessions a day for 12 weeks, so very different than the other devices. I would also argue that the science behind Restorex is more robust compared to the other devices we've discussed. However, they've all studied their devices in scientific literature. Now, this study was studied in 2019 in the Journal of Sexual Medicine, and it specifically looked at the effects of Restorex after 3 months of use, anywhere between 30 to 90 minutes a day. And they saw an average of 11.7 degree reduction in curvature and a 1.6 centimeter increase in length compared to an increase in curvature, actually, of 1.3 degrees in the control group. All right, this is Restorex. This is the box it comes in. Here you see instruction manuals, the main device body, which we're going to go over, protective tape, and extension rods if you need to extend longer. And again, with any of these devices, you're going to measure your stretched penile length first to determine what the size is. And based on your stretched length for the Restorex, they tell you exactly what rod length you should be using. Here's the main device. It comes completely, essentially unstretched. So before measuring your glands, they give you this special, it's called Coban type tape that sort of sticks to your skin and will help protect your skin from any injuries. So you want to put that around very loosely. You don't want to put it too tight. And you obviously want to take it off when you're done using it. Be careful with those scissors near your genitals, obviously. And then you want to place your glans, penis, or the head of the penis into the device. And you see there's those little jagged edges on the side, and that can allow you to go tighter or less tight depending on what is going to be most comfortable for you. And you want to make sure you push that blue back to the other side, and then that will attach. And you can see I just put one click and it's pretty comfortable and snug in there. And again, you can always take it out by pushing the blue button on the top. And you can reattach that, so now you know. And then you insert your penis into the device, again through the circle. You again attach the glands into the holder. And then you could essentially, and see, that was not tight enough. The penis actually fell out. Try that again. So anytime it's too tight or uncomfortable, you can always push the blue button on the bottom side like that to release tension. And then again, you can hold the ring and slowly add tension, and it will go through the different notches on the extension bands or the standard rods there. Now, if you have Peyronie's disease, you can turn this device away from the curvature of the penis to help reduce that curvature. And so for those who do have any sort of curvature, this is a great device because of the ability to turn it or flex it. And once you store it, you want to make sure there's no tension on the device, and you can store that. So this device costs $525 as of the taping of this video. The ProZard has a strong scientific backing, as I mentioned before. They're very committed to evidence-based science. It does offer less daily usage time, and I find that their website gives you a very nice protocol and lots of videos to follow. It does have a very specific design for Peyronie's disease, meaning it extends and rotates, which then targets the areas of plaque that are really needed. Now, cons are that it can be uncomfortable. Now, this is one that I've actually prescribed to a lot of patients, and some like it, and some say that they notice that it's a little bit uncomfortable, the clamping on the penis. And also, it's a little bit more expensive than the other ones. So I've talked about Peyronie's disease before on the podcast with Dr. Jessie Mills, so make sure you check out that, as well as I've made YouTube videos here about Peyronie's disease. So if you want to learn more about that condition, make sure you do that. Now, before you go, I want to talk about some of the common myths about traction therapy that people believe. Now, first off, people think that traction devices can dramatically increase penis size overnight. And the reality is that any gains that you're going to get are very gradual and require consistent use over months. If you're not someone who can stick to a routine and be consistent, then this is not the device for you. Myth number 2 is that these devices are a cure-all for all penile issues. Now, while they do show promise for certain conditions like Peyronie's disease and potentially increasing length, they're not a universal solution. Number 3, traction devices are completely risk-free. Now, while I said these are generally safe when used correctly, they can cause discomfort and potentially temporary side effects like numbness and bruising because of the traction on the nerves. Lastly, myth number 4, more tension means better results. And actually, excessive tension will cause nerve injury. So it's important to follow the manufacturer's guidelines. More is not better. Listen to your body. So if you're considering a penile traction device, make sure, of course, to talk to your urologist, especially if you have a specific condition like Peyronie's disease, and learn about all the options, or at least watch my videos. And be realistic about the expectations. The results are pretty modest, and again, they require consistent use. Start slowly and gradually, and increase usage as recommended by the manufacturer. And again, I can't stress this enough. Pay attention to your body. If it hurts or you're feeling weird symptoms, stop using it and talk to your doctor. And lastly, choose a device that fits your lifestyle. If it's not something that you're going to use because you really don't have 6 hours to hang out and do this, then really that's not the device for you. I hope you guys found this helpful. I do recommend penile traction devices in men who will have Peyronie's disease or want to increase penile length because they're relatively safe. They're easy to do in terms of they're not very cumbersome, and they can work. I do realize there's a cost component, but if you're someone who is really wanting to fix this issue minimally invasively without surgery, I think it's really a great option as long as it fits your budget. I'll link all the devices that we talked about in this video today below, so make sure if you want to check them out, click below. And if you're enjoying my channel, make sure to sign up for my newsletter. My newsletter is called Urology with Dr. Rena Malik, and we talk about new research that I haven't shared on this channel before. We answer subscriber questions. We talk about the contents that we released that week, and also I let you guys know what's going on in my life that week. So if you want to learn a little bit more about me, that's a great place to do that. And as always, I'm going to take care of yourself because you're worth it.